Use it, and so do plenty of men. We're talking about laser technology to remove hair from your back, bikini line, or face. But now, some doctors are feuding with the big chains that specialize in laser, claiming patients are at risk. Mary Murphy is here with tonight's Fact Finders Report. Mary.
All right, thank you, Katie and Jim. Laser has become big, really big business. Some companies have 150 centers nationwide. Well, now some of the smaller medical spas are fighting back, claiming there's often not a doctor in the house at laser centers, and patients are paying a price.
Oh, you think Park Avenue, you think you're in good hands, this is the best of the best. After 6 months, I started noticing dark lines on my face, all along here.
Maria, a new bride, says it was bad enough that she had to shave in between treatments at American Laser Centers to remove hair above her upper lip.
It was $500 for what they said would probably be 6 treatments.
But 2.5 years later, the hair is still there, along with discoloration.
If you start noticing something like that, you would stop those procedures.
American Laser says patients sign consent forms knowing hyperpigmentation is a possible outcome. Out of 75,000 hair removal treatments done nationwide in October, American Laser documented only 20 adverse reactions. Quote, "We have a very, very low incident rate," said Executive Vice President Kevin Pecue. Lots of people want into the hair removal business.
Right now we're going on eBay and we're looking up lasers.
Liza Colby at the Skin Therapy Medical Spa showed us how easy it is for anyone to buy a range of lasers online, from cheaper secondhand models to high-tech devices that can hover near $100,000.
You could buy the laser, open up a location.
It's anywhere from a beauty shop to actually somebody's home.
And lasers in the wrong hands can be deadly. Phony doctor Dean Fiello is facing 20 years in prison after financial analyst Maria Cruz died in his office, probably from anesthesia complications, while he was treating her with a laser.
I have to be here to see for myself that she gets justice.
The law is not consistent when it comes to just who can operate lasers.
If you shoot it into the eyes, the person can go blind. We don't do eyebrows with lasers because the eyes are too sensitive.
In New Jersey, a doctor must supervise the treatments. But New York dermatologist Bill Greenberg points out that's not the case here.
Other spas are starting to buy lasers that don't have physician supervision.
And now there's a showdown between doctors who say they're on site to monitor laser treatments and the longtime anestheticians who say a doctor is always on call.
I have a doctor, plastic surgeon.
That supervises this location?
Yeah.
He can be down the block, he could be in another state, he can be in Europe.
The smaller, intimate medical spas are facing stiff competition from chains like American Laser and Laser Cosmetica.
They have to be like on staff, but they don't have to be here.
And that's a fact here in New York.
That's my bread and butter, and only one who going to work in this laser is myself, because this way mistakes they don't happen.
Rujita Palika, who's been in the beauty business for 29 years, showed us the certificate that states she received training on the 2 different laser machines in her spa. And while Palika specifically treats the patients herself, Maria had rotating technicians work on her, and when she complained about her lip,
The only time they really are available to speak with you, it seems, is when they're trying to sell you more of their products.
Dr. Greenberg says technicians need to ask if you've had recent sun exposure because the laser can affect the melanocytes in your skin. He has seen patients with all kinds of pigmentation problems who went to many other laser centers.
Where the skin is lighter, so you have dots all over your arms.
Right now, Dr. Greenberg is trying to find a solution for Maria's skin.
We might try something like a photofacial, which is good for aging spots that are browns. And we can also try higher dose hydroquinones. It's a serum, so it gets absorbed very well.
The executive vice president for American Laser Centers told me tonight if there's a patient problem with pigmentation, the company would offer a complimentary microdermabrasion. But Maria claims she was offered a package of 10 treatments for $2,500. If you would like to see this story again, please log on to CW11.com/factfinders.
Okay. Thanks very much, Mary. Have a good holiday. Well, business news now, and of course the big business question this time of year is how is the